Good morning. Good morning, everyone.
Good morning, sir.
Good morning, sir.
Good
Good
morning,
morning.
sir.
Okay. So, okay. I hope we are clear till now. Na? We discussed till the sternum, and we talk. Okay, this was important that we talked about the attachment of the ribs, how they are attached with the vertebrae, है ना? And how we classify like which particular vertebra it corresponds to which particular rib, you know, how we classify that. We talked about that thing, and then we talked about their attachment on the anterior side, and then we talked about the sternum, and we also discussed this particular joint, that is the manubriosternal joint, and why this particular structure has it holds a lot of significance. You know, we talked about all these things, and we discussed that there is a lot of significance of this particular level. Okay, that is the manubriosternal joint. Okay, now let's talk about the intercostal nerves. It basically means we are just supposed to talk about, as we discussed in the previous classes as well, like there are certain nerve roots, like we talk about nerve root, let's say C1 C2 or C3 C4. I hope everyone is aware of the term myotome and dermatome. Can anyone tell me?
Yes, sir.
Okay, can you tell me
Yes, sir.
what does a myotome mean and what does a dermatome mean?
Myotome means nerve endings applied to a particular muscle, whereas
Okay.
dermatome means nerve ending, a free nerve endings applied to a area of skin.
Yeah, it applied to area of a particular skin, and myotome means, as the name suggests, myotome. It means for the muscle. You know, it means a particular segment of you can say particular segment of nerve root which supplies a particular, you can say, muscle, and that's why when we talk about myotomes, we just remember it by certain actions. Like for C1 C2 we remember it that there is neck flexion, there is you can say sideways lateral flexion of the neck for I think C3 something like that, and for C4 it is shoulder shrugging. So it means that when we talk about C4, so it means that we are supposed to talk about that particular part of nerve root which is responsible for that particular those particular muscles which are eventually responsible for providing shoulder shrugging. So it means that we are, in terms of myotomes, we are talking about that particular nerve root which is responsible to perform certain action, and in dermatomes.
Sir,
Hmm.
problem with your voice. Okay.
Okay, this again. Just let me just exit it, and I will again join it. Just give me a second. Is it better now?
Yes, sir.
Okay. I hope it's better. Um. Okay.
Yes, sir, it is better.
Okay, great. So, okay, so I was saying just that a particular segment of, you can say, nerve roots which are responsible for to perform particular action, that then we call it as myotome. And likewise, if we talk about a certain segment of nerve root which is responsible for, you can say, to supply a particular segment of this thing, the area of the skin, for that we call it as the dermatome. So here we are supposed to talk about the intercostal nerves. It means we are supposed to talk about those nerve roots which eventually which are responsible for, you can say, to supply the region or the area which are more or less, you can say, related to the thoracic region. So here we are, of course, we are supposed to talk about from the level T1 up to T12, because up to T7 we can say that T7, sorry, C7 T1 up to C7 T1 we can say that, of course, it is more or less responsible to supply the upper limb. And after T12, when we talk about the lumbar segments, you know, we talk about the lumbar nerve roots. We more or less we talk about the actions and the nerve supply of the lower limb. But here we are solely we are focusing on the nerve segment T1 to T12. Okay, T1 to T12. So first of all, the thing is that the nerve roots T1 to T11, those are the nerve roots which are called as intercostal nerves. Okay, and if we talk about the T12, that is not an intercostal nerve, that is called as subcostal nerve. Okay, why? Because here we see, if we talk about the nerve roots T1 to T11, more or less we will see that they we'll talk about this in detail here, but we will see if we talk about the nerve. I hope till now everyone is clear about nerve roots. आई थिंक सबको आइडिया है कि हम किस चीज़ के बारे में बात करें. वी आर जस्ट टॉकिंग अबाउट these are the spinal nerve roots. Okay, and right now we are talking about the thoracic segment of the spinal cord, है ना, not the spinal cord but the nerve roots. We are talking about the spinal nerve roots in the thoracic region. And what we say that if we want to use the term intercostal nerves, we must talk about the nerve roots T1 to T11. We are not supposed to talk about T12. Why? Because when we use the term intercostal nerves, it means we need to talk about those nerve roots which are supplying the thoracic region, and you can say a combination of thoracic as well as abdominal region. But if we talk about T12 nerve root, T12 it only supplies the abdominal region. It has no relation to the thoracic region, and that is the reason why we say that T12 nerve root is called as subcostal nerve root. Subcostal, it means costal means the thoracic region, you can say. Sub means below that, it means below the costal region. We have got the T12 nerve root which supplies the subcostal in the abdominal region, but it has no link with the thoracic region. Okay, but if we are talking about the nerve roots for the thoracic region, in that case we are supposed to talk about T1 to T11. Just tell me till now, are we clear with this thing? The intercostal nerves are only T1 to T11, not T12.
Yes, sir.
Okay.
Yeah.
Okay, so out of these nerve roots T1 to T11, we can simply say T1 to T6. Half of these T1 to T6, these are the typical type of intercostal nerves, and the rest T7 to T11, they are, you can say, atypical type of nerve root, intercostal nerves, or you can call them as thoraco-abdominal nerves. Simply, we can see here, like it is written here that we can see that the nerve root T1 to T6, those are called as typical intercostal nerves. Why typical intercostal nerves? Because they are solely related, or you can say they are mainly supplying only the intercostal region only. They are not supposed to supply the abdominal region at all. So it means T1 to T6. But if we precisely look at it, we can say T3 to it. Some of the books it says T3 to T6, and rest of the books it says T1 to T6. So you can just remember the upper six nerve roots, T1 to T6. You can just remember that those are the typical type of intercostal nerves. Why? Because they only supply the thoracic region. They only thoracic wall supply for the upper thoracic nerve roots. But when we come below T6, it means T11 to T12, not the up to T11, T7 to T11, not T12. Why? Because these are the atypical type of nerve roots. Why? Because they, along with the thoracic region, they also supply the abdominal region. Okay, they are not just supplying the thoracic region. Along with thoracic, they supply abdominal region as well. So that is the reason why we call it as thoraco-abdominal nerves. T7 to T11, we call these as thoraco-abdominal nerves. Okay, so we can see that they're supplying the thoracic region. Along with that, they supply the anterior lateral wall of the abdominal wall as well. Okay, and that is the reason why we call T7 to T11 as atypical type of intercostal nerves. Just notice that we are not talking about T12. Why? Because T12 is not related to intercostal nerves. It is a separate nerve, and it supplies only the abdominal region. So here we can see the T12 nerve root, that is the subcostal nerve, that supplies the abdominal wall. Along with that supplies the skin of the buttock. Okay. So but we can see that T12 not part of the intercostal nerves. Only T1 to T11 and upper six nerve roots up to six, the thoracic nerve roots, we call it as typical intercostal nerves because they only supply the thoracic wall, but the rest T7 to T11, they supply, along with the thoracic region, they also supply the abdominal wall as well. Precisely speaking, the anterolateral wall of the abdominal wall. So that's why we call it as thoraco-abdominal nerves. And the T12, it has no relation with the thoracic region or the intercostal region, and it only supplies the abdomen as well as the skin of the buttock, and that's why it is not called as intercostal nerves. It is only called as subcostal nerve. I hope till now everyone is clear.
Yes.
Okay.
Yes.
Okay. Now, if I say that the T2 nerve root T2, it is also called as intercostobrachial nerve. The name of just the way we saw that T12 is also called as subcostal nerve, we can see that T2 is also called as intercostobrachial nerve. Can anyone tell me, we have talked about this particular nerve in a particular structure.
The
But
axilla,
axilla.
medial border.
Yeah, exactly. In the medial border of the axilla, we saw that there was this particular nerve that is a that is a T2 nerve that was running along the medial wall of the axilla, and that was also called that. And this particular nerve is also called as intercostobrachial nerve. Just remember this thing. Okay? Intercostobrachial nerve. And if anyone asks you which are the nerve roots we are supposed to talk about when we talk about the intercostal nerves, can you tell me? Can anyone tell me which are the nerves which we are
T1 to
T1 to T1 no, no,
T1 to 11.
T1 to when we're talking about intercostal nerves, we are supposed to talk about T1 to T11. The typical type of intercostal nerves, yeah, T1, that is T1 to T6, because they supply only the thoracic region, and atypical type then we can talk about T7 to T11, and T12 has no relation with the thoracic region. It only supplies the, you can call it as subcostal nerve, and it supplies only the abdominal as and the skin of the buttock, but no relation with the intercostal region, or you can say with the thoracic region. Okay. Now the thing is that just okay. So here we can see we are supposed to talk about the intercostobrachial nerve. First of all, huh,
Problem with your voice.
uh, is anyone else also having the same problem?
Yes, sir.
Yes, sir.
Is it better now? Like right now, I am speaking a bit slower. Like, is it better now, or is it the same?
There is some disturbance.
There is disturbance. Just let me just exit it and join it again. Just give me a second. Better now?
Yes.
Sir.
Yes, sir.
Okay. It's good that just let me know if there is any issue with the audio. Just let me know so that I can do something for that. I think it's not the problem with the internet. I guess I think there is some glitch with this Google Meet only. Do you people recommend that should I change the platform? Should I jump over to some other thing like Zoom or something else? What do you guys recommend? Like we can jump over to some other platform. Let's see if
No, sir, no.
hmm,
Not on
no
Zoom. Zoom is not working in my mobile.
uh, Zoom doesn't work in your mobile.
Yeah.
Uh, so you are advising me to change the platform?
No, sir. Google is fine.
Okay, I
No,
will
sir.
see if the same problem persists, and if we face the same problem daily. In that case, we will try something else. Let's say we will try some different platform, maybe for a particular class. If we feel comfortable, then we can continue with that only.
Okay, sir.
Okay, because uh, we are facing this problem daily, this audio problem. Okay. So, okay, so now we are supposed to talk about the intercostobrachial nerve. Intercostobrachial nerve, it means this T2 nerve. First of all, we saw that it was running along the medial wall of the axilla. This we saw when we were talking about the axilla. Apart from that, we can see it mainly supplies the skin of the floor of the axilla. I think everyone is clear with this thing. We talked about the axilla. We saw that it is more or less pyramidal in shape. It has got four sides, and then it has got an apex and a base, and the base is made up of the skin. And we can see that it supplies the skin region of the axilla. Apart from that, it supplies the upper part of the arm as well. So that is the intercostobrachial nerve. And now there is a significance of this particular nerve, that in case of CAD, can anyone tell me the full form of CAD? It is related to heart.
Coronary artery.
Yeah, exactly. Coronary artery disease. Can anyone tell me what is the coronary artery? What is the function of coronary artery?
Due to atherosclerosis.
Yeah, it supplies the myocardium, right? We have got how many different type of muscles have we got in our body? How many different
Three types
We've
of
got.
muscles.
Okay. Can you name it?
Skeletal muscles,
Yeah.
cardiac muscles, smooth
And
muscles.
smooth muscles. And which is the type of muscle which we usually talk about?
Skeletal.
It is a skeletal muscle, huh? It is a skeletal muscle. So there are skeletal muscles which are more or less more we can say that they are related to the actions of a particular person, like the actions that we perform. Then we have got the smooth muscles, which are related to the viscera. And when we talk about the wall of the stomach or something else, let's say the lungs and all those things, there we can talk about those type of muscles which are called as smooth muscles. And then there is the cardiac muscle, which is the myocardium, which is present outside the heart and helps in the pumping action of the heart. Can anyone tell me what type of muscle the diaphragm is? Is it smooth muscle? Is it skeletal muscle?
Skeletal muscle.
It is a skeletal muscle, no? It is a skeletal type of muscle, and that is the reason why we are talking about it, because we are morely we are related, we are focusing on the skeletal muscles because they are the main muscles which are responsible for certain actions. So that's why we are talking about diaphragm as well. Okay, so here we can see in case of coronary artery disease, I would we have seen this thing that if a person is having coronary artery disease, in that case the person complains of having, you can say, thrombing pain on the chest, and the pain is radiating along the left side of the arm. Have you seen any person who might have suffered with CAD? If you ask them, they will tell you that this is a common symptom in almost every person suffering from CAD. That the pain was like it was radiating along the left arm, mostly through the medial aspect of the arm, and along with that there was a throbbing pain in the chest, and the left arm also felt a bit heavier. So it is one of the most common symptoms that we come across in case of CAD. And the nerve which is responsible for the referral of this particular pain, for why the pain is, you can say, transmitting along the left arm, for this particular thing we can talk about typically about this particular nerve, that is the T2. So we can say that it is because of the T2 nerve, the pain eventually radiates, and it goes into upper limb, and it flows along the medial aspect of the upper limb, and that is the reason why a person feels radiating pain in the left side of the arm in case of CAD. Okay, and here the same thing is written that typical intercostal nerves, you can say either T3 to T6, or you can say T1 to T6. It depends. Let's say if you are giving any exam, and in that case if you get an option, uh, let's say if you get both the options, T1 to T6 as well as T3 to T6, I would suggest that you must go for T3 to T6 over T1 to T6. If they ask you which are the nerve roots, or the thoracic nerve roots, or the thoracic intercostal nerves which are typical, so in that case, if you got both the options, T1 to T6 and T3 to T6, in that case I would suggest that you must go for T3 to T6, because T3 to T6 is more precise than T1 to T6. In that case you must go for this one. Otherwise they won't do this. Either they will give you T3 to T6, either, or else they will give you T1 to T6. They won't give you both. And I hope everyone got this. And if you talk about the atypical nerve root, intercostal nerves, in that case we can talk about T7 to T11, not T12. Okay, I hope this slide is clear to everyone.
So sorry, but
Yes, sir.
वॉइस में फिर से प्रॉब्लम आ रही है.
वॉइस में फिर से प्रॉब्लम है, सबके लिए प्रॉब्लम है.
Yes, sir.
Yes, sir.
um, एक सेकेंड, मैं जस्ट लेट मी चेंज द इंटरनेट. मे बी शायद इंटरनेट की वजह से हो, आई डोंट नो. जस्ट गिव मी अ सेकेंड. So, is it better now? I've changed the internet connection.
No, sir, still the same.
Still the same. Just give me a second then. I think it's better now.
Yes.
Sir, but
I really don't know what. I think the problem is with the platform only. I don't know. I will try this. Let's change the platform maybe for one or two classes, and let's see if it becomes better. Which one do you suggest? Should we jump over to Skype or something else or Zoom? Which one do you suggest? Uh,
Right,
m-
maybe.
Skype?
Your wish, sir.
Okay. Okay. Let's see. Let's see. We can jump over to Skype maybe. We will see. Okay. So okay. I think this thing is clear to everyone. This particular slide is clear to everyone. The typical and the atypical type
Yes.
of
Yes, sir.
intercostal nerves. Okay. Now we are supposed to talk about the pleura. Okay, pleura. What does pleura mean? Pleura simply means the covering of the lungs. Okay, so we can see that just the way we saw that. Uh, uh, okay, we saw that. Let's talk about heart. So in case of heart also we can see we have got the myocardium and
Pericardium.
yeah, we have got the pericardium. We got the layers which are wrapped around the heart. Likewise, if we can talk about the lungs as well. Then we also we can see we've got the pleura, which is basically the covering of the lung, which is present around the lung, and we can see we got basically two different type of pleura. One is the parietal pleura and the another one is the visceral pleura. Visceral pleura simply means it is related to the viscera. Viscera means the structure, the lungs. You know? So it means the layer that is related to the viscera, that is called as the visceral pleura, and of course that is supposed to be the inner part, or you can say the inner layer, and the parietal, that is the outer layer. The outer layer and the inner layer, the visceral pleura and the parietal pleura. The parietal pleura is the outer layer, and the visceral pleura is the inner layer. And then we can see that we have got one more structure that is called as hilum. We will see hilum here. Okay, here we can see we have got this particular structure. Okay, here we can see that this is the outer layer, the shown in green. This is the outer layer that is called as the parietal pleura, and then the one shown in red, that is called as the visceral pleura. We've got these two layers of pleura covering the lung, and then we can see at a particular region they both connect to each other, and then they leave a space in between so that there are certain structures, here we can see we have got the bronchi as well as certain neurovascular structures which are supposed to enter and exit the lungs, and this particular region that is called as the hilum. Okay, so hilum simply means this particular. Okay, so here we can see these two parts are continuous with each other at the hilum. Okay, these two layers, the outer layer and the inner layer, they become continuous. They connect to each other at a particular region, and that region is called as hilum. Okay, and the hilum region is found is where the bronchi, arteries, veins, and nerves enter and exit the lungs. Okay, that region is basically called as hilum. I hope everyone is clear with these terms, hilum and these two layers, the outer layer and the inner layer. Okay.
Yes, sir.
uh, okay, now we are supposed to talk about these layers, and we can see first of all the thing is that if we talk about the outer layer, the parietal layer, we must know this thing, that the parietal pleura is pain sensitive, because it means that if something, you can say, pinches into the parietal pleura, we can have this pain sensation, but the pain sensation is not in the visceral pleura. Okay, there are no you can say there are no nerve innervations which are responsible for pain in the visceral pleura. It means visceral pleura is not pain sensitive, but the parietal pleura, it is pain. These are all, you can say, potential questions for the exams, for the entrances. Okay, these are all directly asked questions. So parietal pleura is pain sensitive, but the visceral pleura is not pain sensitive. But on the other hand, we can see that visceral pleura is stretch sensitive. Stretch sensitive means, just give me a second, it is written somewhere here. um, uh, 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 I don't know where, but okay, here I think it is written that um, okay, here it is written that it's sensory fibers which the visceral pleura's sensory fibers, they detect stretch. Okay, it means visceral pleura is stretch sensitive, but it is not pain sensitive as well as not touch or temperature sensitive. Let's remember this thing. But if we talk about the parietal pleura, the outer layer, in that case we can say that it is sensitive to pain as well as pressure and temperature. Okay, simply the parietal pleura response, it is sensitive to pain, pressure, temperature, but the visceral pleura, it is not pain sensitive, not temperature sensitive, not touch sensitive, but it is sensitive to stretch. If there is you can say excessive stretch of this particular, it is you can say it will respond. The visceral pleura, it will respond. Okay, and we will talk about that, why it responds to stretch. We will talk about that as well. But right now we can see that it is only stretch sensitive, the visceral pleura. Let's talk about, if we have come to this particular slide, let's talk about their nerve innervations and their blood supply as well. So here we can see, first of all, if we talk about the nerve innervation, here we can see we have got the phrenic nerve. We are talking about the parietal pleura, the outer layer. We can see we have got the phrenic nerve. Can anyone tell me the nerve root for phrenic nerve? I think we discussed this. The nerve root for phrenic nerve. um, we discussed this thing, right? If a person suffers, huh, it is C3 C4 C5, right? It is C3 C4 C5. And I told you that if a person suffers spinal cord injury, in that case, if the level of spinal cord injury is 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 at the level of C5 or above C5, in that case it will become, for sure it will become fatal for the person, because of course now we can see the phrenic nerve. It We can see here, phrenic nerve, it is supplying the pleura, as well as majorly it is supplying the particular muscle. Phrenic nerve supplies the particular muscle,
Diaphragm.
the diaphragm. And we know that diaphragm is the major muscle that is responsible for ventilation, for respiration. So we can say that if the diaphragm is getting affected, in that case the person, we need to give ventilatory support to that person, so it means that it means if they ask you what is the uppermost layer, uppermost level of spinal cord injury, above which it might become fatal for the person. So it means that is C5 level, above C5, at the level of C5 or above C5, it will affect the phrenic nerve, and then in that case the person's diaphragm will not function properly, and in that case the person needs ventilatory support. And there is a very little chance of the person to survive, because of course when the person has been given the ventilatory support, there is either we need to continue with it, or we can just remove it, and the person might not be able to survive without ventilator support. Can anyone tell me, there is a term given to the process where we slowly lower down the this thing, the what to say, the ventilator, and then we remove it. There is a process through which we remove the ventilator. Let's say there is a hopeless case of a person where we can't do anything. In that case, with the consent of the patient's family, the this thing the ventilator is its intensity is decreased, and eventually it is shut down. So that process, can anyone tell me the name?
Sir, weaning
Yeah,
being
exactly. That
something
it
like
is
this.
called as weaning. Okay, WEANING, I think. Weaning of it is called as weaning of ventilator. Okay, that is the process. We don't remove it abruptly. Okay, it is decreased day by day, or you can say maybe hour by hour, and then it is completely stopped. Okay, that is called as weaning of this thing of ventilator. Okay, so here we can see we have got the phrenic nerve, which was supplying the diaphragm. It is supplying the parietal pleura as well. Along with that, we have got certain intercostal nerves as well. Okay, intercostal, just we talked about this here, na? The intercostal nerves. Okay, apart from that, if we talk about the visceral pleura, में we can see that a network of nerve derived from sympathetic trunk and the vagus nerve. First of all, I think we all know vagus nerve. Can anyone tell me what is the vagus nerve? Is it a nerve root, or is it a cranial?
And cranial nerve.
It is a cranial nerve. And can anyone tell me what is the sympathetic trunk, or what is the sympathetic nervous system? We are going to talk about these terms in neuro, but
Fight flight condition.
huh?
Sympathetic.
You're saying fight and flight condition, huh?
Fight flight. Yes, sir.
Yeah, okay. The thing is that in our body we have got certain. If we talk about the spinal cord, we have got certain level of spinal cord through which we can see there are certain nerve roots which are coming out, which are mainly responsible for sympathetic action of the body. And then we see that there are certain segments of the spinal cord through which, when the nerve roots come out, they are mainly responsible for the parasympathetic function of the body. Now, what is sympathetic? Simply means, let's say if we are in an emergency condition, where let's say we need to, either we need to fight, or we need to run away. That is called as flight. Fight or flight. If we are in a fight or flight condition, in that case, what we'll see that the blood supply to the muscles will increase, so that we can use them more efficiently. the pupil will dilate so that we can get more light into our eyes, and likewise we can see all these things happening in the body. Yeah, and that is called as sympathetic. It means sympathetic system gets activated, and because of that our body gets ready to either fight or maybe run away from that situation. That is called as sympathetic system. And on the contrary, we talk about parasympathetic. Parasympathetic simply means rest and digest. It means now our body is at complete ease, complete rest, and now we can see that our body is functioning on the digestive system. In that case, we can see that the blood flow increases towards the alimentary canal, and of course the blood supply to the muscles will decrease a bit, and you can see the pupil, they are not that much dilated, they become a bit constricted, and we can talk about all these things, and that is related to the parasympathetic system. And can anyone tell me which segment of spinal cord gives out the sympathetic trunk? Does anyone have any idea about this?
तो craniosacral,
Na-
thoracolumbar, दो में कोई होता है सर.
it is thoracolumbar region. It is thoracolumbar, and if we talk about the parasympathetic, it is craniosacral. Just let me show this. Sympathetic trunk. Just a second. Okay. Okay. I think okay, here we can see in this particular image. Okay, here we can see we have got this particular segment, that is it is shown in red. Why shown in red? Because it is related to the sympathetic system. So here we can see we have got the thoraco and the lumbar region, thoracolumbar. So we're not right here, they have shown the vertebral column, but we are more concerned with the spinal cord. So we can see in the thoracic, the nerves coming from the thoracic as well as the lumbar region. We can see that those are the nerve roots which are mainly responsible. We can call it as the sympathetic trunk, and we can see these are the nerve roots which are supplying, or you can say which are responsible for the sympathetic system of the body. And if we talk about the parasympathetic, here we can see this is shown in blue. It is the parasympathetic. We can call it as craniosacral. Okay. So if we talk about the parasympathetic origin from the spinal cord, it is from the craniosacral region, from the cranium, shown in blue, cranium as well as from the sacrum. Okay. So these are the parasympathetic trunk responsible for rest and digest of the body. And if we talk about the sympathetic trunk, we can say that it is responsible for fight and flight. That's why it is shown in red. Okay. uh, okay, I think this much is clear to everyone. The sympathetic and the parasympathetic trunk, from which segment of the spinal cord
Yes,
it is
sir.
coming out. Okay.
Yes.
And sympathetic and parasympathetic, they're part of which type of nervous system? Of autonomous, no?
Autonomic nervous
Autonomic
system.
nervous system, they are coming out, they are part of autonomic nervous system. Okay. uh, um, okay, so here we saw that if we talk about the visceral pleura, it gets its innervations from the sympathetic trunk as well as from the vagus nerve. Okay, so we have talked about the nerve supply for parietal nerve. It is the phrenic and the intercostal nerves. And if we talk about the visceral pleura, we have got the sympathetic trunk as well as the vagus nerve. Okay. Apart from that, if we talk about the blood supply, in that case we can simply remember that intercostal arteries for the blood supply of the parietal pleura, and we can see the bronchial arteries, which is a branch of descending aorta. We talked about descending aorta yesterday, na? We talked about
Yes, sir.
ascending aorta and the arch of aorta and the descending aorta, and there was a common segment, that is the manubriosternal joint, which was present at the end
Yes.
of the ascending and okay. So here we can see that the bronchial artery, which is coming out from as a branch of the descending aorta. Okay, that's from the descending aorta. Bronchial artery supplies the visceral. I think this thing you need to remember this only. Okay, the bronchial arteries supplying the visceral pleura, and the intercostal artery supplying the parietal pleura, and phrenic and intercostal nerves for the parietal pleura, and sympathetic trunk and vagus nerve for the visceral pleura. Okay, and apart from that, just remember that visceral pleura is not sensitive to pain, temperature, and touch. It is only sensitive to stretch, but parietal pleura, it is sensitive to all these things. Okay. Okay, we are done with the neurovascular supply of the pleura. Okay, now let's talk about the significance of pleura. Like, why actually is it present in the body? Okay, so we have talked about this thing. Here we can see the phrenic nerve C3, C4, C5. Okay, so we can see. Okay, let's talk about this first. Right now we are talking about the parietal pleura. So we can see, we can name the parietal pleura according to the different region where it is present. Like we can see here, this is the whole lung. Okay, this is the right lung and this is the left lung. But here we can see we have got the parietal pleura, which is covering, which is a covering over the lungs, and we can name different parts of the parietal pleura according to their placement, like in which particular segment they are present. According to that, we can name different parts of the parietal pleura. First of all, we can see here the uppermost part of the parietal pleura. Of course, it is present more, you can say, closer to the cervical region, and we can say this part, this shown in green, this particular segment of the parietal pleura, it is called as cervical part of the parietal pleura. Okay, here we can see. Uh, the cervical pleura. Okay, that means it is the cervical part of the parietal pleura only. It means the topmost part. Likewise, we can talk about the medial. This is shown in yellow, the medial part of the parietal pleura, that is shown in yellow here, and we can call it as mediastinal pleura. So if they use these terms, the mediastinal pleura or the cervical pleura, just remember that they are not something different. They are just part of the parietal pleura only. Okay. Likewise, if we talk about the costal pleura, we can see the part of the parietal pleura that is in relation with the ribs on the lateral side. That is called as the costal pleura, and the lower part of the pleura, the parietal pleura, that is present near the diaphragm, and that is called as the diaphragmatic pleura. I hope this thing is clear to everyone. We have just talked about the different segments, okay, different segments of the parietal pleura according to their placement at different parts of the lung. Okay, the cervical, the costal, mediastinal, and then we have got the diaphragmatic. Okay, and here we can see we have got the inverted U-shaped diaphragm, umbrella-shaped diaphragm, which is present below this structure. Okay, and okay, we have seen the four different segments of parietal pleura according to their placement in different segments, you can say. Okay, and we have got the mediastinal, we have got the cervical, the costal, and the diaphragmatic pleura, and which are eventually parts of the parietal pleura itself. Okay, I think we are clear till now.
Yes.
Sir,
Okay. Uh, okay, okay. Is, you having any doubt or something, or okay? Okay, so okay, so now moving up to the, okay, we talked about the visceral pleura. It is not sensitive to pain, touch, temperature, but sensitive to stretch. And okay, now let's talk about the pleural cavity. Why? What is the significance of the parietal and the visceral pleura? First of all, the thing that we need to talk about, the term that we need to talk about is the surface tension. Surface tension, it means, first of all, we will see, we saw that the outer green layer, it is the parietal pleura, and the inner red layer, it is the visceral pleura. Okay, and we can see the space between these two pleura is the pleural space. Okay, and we can see in this particular space, in this particular cavity, we have got this fluid, this serous fluid. Okay, and here we can see the pleural cavity is potential, it is a space between the outer layer and the inner layer. Okay, and that is called as the pleural cavity, and we have got a pleural fluid which is present between these two layers. Now what is the significance of this layer is that it has certain level of surface tension. Now what is surface, does anyone know the meaning of surface tension? Like, uh,
yes, sir.
can you explain?
Tension of fluid exerted on a surface.
Yeah, exactly. Let's say we have a ball of water, and we place a leaf on the surface of the water. So we will see, because of the weight of the leaf, we will see it will put some force on the water, and we will see that there will be some buoyant force of the water upward. Now we know that water has got buoyancy, water has got this upward force as well, and that is the reason why these ships and boats, they all can float on water. So we can see, that particular part of the water, we will see that there will be some amount of tension, or we can say certain amount of force that will be along the surface of that particular water surface, and because of that, So we can see that that tension is being created in the on the surface of water because of the object that is being placed on that particular water surface. So that is called as surface tension. So here we can see in this particular fluid, in the pleural fluid also we can see there is certain extent of surface tension, or you can say certain amount of force that is present inside this particular fluid. And because of that, when, let's say, when we inflate, when we are inhaling, in that case, of course, first of all, we can see that this is, here they have shown the ribs, है ना? This is the rib. Then we can see this is the parietal pleura, this is the visceral pleura, this is the lung, and this is the pleural cavity in which we have got the pleural fluid. Now what we can see, that in when we inhale, of course the ribs will move outwards, you know, because of the pump handle and the bucket handle movement. We will see that the ribs, they move outwards. Now we know this thing, that the parietal pleura, the outer pleura, it is attached to the inner surface of the ribs. Okay, the parietal pleura, it is attached to the inner surface of the ribs. So of course, when the during inhalation, we will see as the ribs move outwards, the outer layer of the of the pleura will also move along with the rib. Okay, now what is the function of the fluid is that it ensures the movement of the visceral pleura along with the parietal pleura. It means during inhalation, when the ribs are moving outwards, the parietal pleura is also moving along with the ribs outwards. And in that case, we also want the visceral pleura to move outwards, and to ensure that the inner layer moves along with the outer layer. That is being ensured by this particular fluid that is present inside. Okay, and that is called as the pleural fluid. And that particular you can say feature of this particular fluid is called as surface tension. Because of surface tension only, this fluid is able to move the inner layer along with the outer layer during inhalation. I hope this thing is clear to everyone. Okay, we can see that that in case of inhalation, the pleural fluid, it ensures the movement of inner layer along with the outer layer. When the outer layer is moving outwards, we can see the inner layer should also move outwards, so that as a whole the volume of the lung increases. Okay, to ensure that when the thorax expands, the lung also expands. Okay, filled with air. This fluid makes sure that the inner layer moves along with the outer layer outwards during inhalation, so as to maximally increase the volume of the lungs. And that is the function of of this particular fluid, and that particular property of this fluid is called as surface tension. I hope everyone is clear with this thing. The proper the
Yes.
Okay, the reason why this fluid is present here. Okay.
Yes, sir.
Okay, apart from that, we can see that it lubricates the surface of the pleura also. It is for the lubrication as well. But apart from that, we can see it is mainly responsible. So let's say if there is any condition where we see that this particular fluid gets affected. Let's say if this fluid is not present here, or let's say if there is any air bubble or something that enters this fluid. In that case, of course, the surface tension of this fluid will decrease, and because of that, the efficient movement of the inner layer will get affected. And the movement of the inner layer along with the outer layer during inhalation, it will decrease. And because of that, eventually the overall increase in the expansion, or you can say increase in the volume of the lung, will decrease. And eventually, because of that, the respiration as a whole, the respiration of the person will get affected. And in that particular condition, we call it as pneumothorax. Okay, pneumothorax simply means, when they ask you the pneumothorax simply means, if some air bubble, it enters this particular pleural cavity, and because of that, it decreases the surface tension of this fluid. And because of that, now we can see there is a bit less or no movement of the inner layer along with the outer layer during inhalation. In that case, the overall capacity of the lung to expand decreases, and that as a whole affects the whole respiratory system of the person, and that condition is called as pneumothorax. I hope everyone is clear with the term pneumothorax. Okay, pneumothorax, and also the function of this particular fluid. Likewise, pneumothorax. Okay, likewise, here we can see we have got other terms as well. Okay, so we saw that if the air enters it, we can call it the pleural cavity, we can call it as pneumothorax. Likewise, if, let's say, the blood enters the pleural cavity, in that case we can call it as hemothorax simply. Or let's say if fluid enters it, that case we can call it as hydrothorax. And if in case when if there is some pus formation, okay, pus formation is because of you can say some pathogen affecting the body. In that case, in response to that, there is pus that is being formed, okay. And in that case, if that enters the pleural cavity, in that case we can call it as pyothorax. Pyo means pyogenic material. The pus is also called as pyogenic, okay, pyogenic material. So pyogenic, if pyo enters the thorax, we can call it as pyothorax, okay. Pyothorax, hydrothorax, pneumothorax, and hemothorax, okay. And in case if we see a person having such kind of a condition, in that case there is this thoracosynthesis, of course, where a particular segment, we can say, of the lung is punctured, and we can say we're just trying to puncture the pleura, the outer pleura, and then we try to take out the excess, you can say maybe the blood or something, the pyogenic material or something, and that process is called as thoracosynthesis. There is another term that is called as amniocentesis. Does anyone know the meaning of amniocentesis?
So, amniotic flow like a process.
Yeah, exactly. In case of we can say pregnant women, we can see if we want to there is this amniotic fluid which surrounds the fetus inside the womb, and let's say if we want to check certain things, like let's say if we want to check maybe maybe the prevalence of certain condition or something, in that case we go for amniocentesis. We just take that amniotic fluid, a bit of that, and then we do certain tests so as to check the prevalence of certain, maybe certain condition or something else. So that is called as amniocentesis. Here we can see this is called as thoracosynthesis, okay. Okay, I hope till now we are clear till now.
Yes, sir.
Okay, now, okay, now let's talk about the pleural recess. There is another term that is called as recess. Okay, we talked about the different parts of the parietal pleura. I hope everyone remembers this, no? That the cervical, the costal, the mediastinal, and the diaphragmatic. We have got different parts according to their placement. You know? Yeah, according to to their placement on the different segments of the lungs, you can say. Okay, now we are supposed to talk about pleural recess. So basically, what recess means, we can see here that let's talk about this particularly because this is visible properly. We can see that the lungs are present here, but of course we can see there is certain segment of the parietal pleura which is present, you can say, excessively, or you can say which is not completely covering. Like here we can see, अगर हम lung की बात करें, we can see lungs are present up to this particular extent. Okay, but here we can see we got this particular segment of the parietal pleura where the lung is not present. Okay, or we can say that the region where the opposing surfaces of the parietal pleura touch each other. Okay, we can see that the visceral pleura, it is present around the lungs. Okay, visceral pleura is not like this. Visceral pleura is the inner layer of the pleura. It is present all the way around the lungs. But if you talk about the outer layer, the parietal pleura, that we can see that is present at this particular segment. We can see it is present here where the lung is not present. Lung is present somewhat till this extent. यहाँ तक lung present है. But after this we will see we have got extra part of this pleura, the parietal pleura, where the lung is not present, or we can see where the opposite surfaces of the this thing of the parietal pleura, they touch each other. Okay, that segment of the parietal pleura is called as recess. I hope everyone is clear with the term pleural recess. Okay, the okay the segment or the part of the okay, you want me to repeat it? Okay, I was saying that the part or the okay, the segment of the parietal pleura where we can see there is no lung which is present there. Okay, we can see the lung is present here up to this particular extent. Up to this particular extent, we have got the lungs which are present here, and there is no lung, you can say, of course, which is present in this particular segment. It means that this particular segment of the parietal pleura is the region where there is the lung is not present here, you know? The lung is present up to somewhat this extent. So we can say that in this particular segment we will see the opposite surfaces of the parietal pleura, they tend to touch each other. Okay, and that region is called as the pleural recess. Then when we are talking about the pleural recess, we are talking about the parietal pleura only. We are not talking about the visceral pleura. Okay, I think this is clear to everyone now.
Yes.
Okay,
Yes, sir.
and why
Yes,
not
sir.
the visceral pleura? Because visceral pleura is completely intact with the lung. Okay, it is completely intact with the lungs. But the parietal pleura, it is not completely intact. We can see there are certain regions like this where it is present, where the lung is not present. Okay, so we can say that those particular regions where opposite surfaces of the parietal pleura comes in contact to each other, those regions we can call it as pleural recess. Now we have got typically two regions of the, you can say, the parietal pleura, where we have got the recess. First of all, this region only, that is called as costodiaphragmatic recess. This is the costal surface of the parietal pleura. This is the diaphragmatic surface of the parietal pleura. So here we can say this particular region, that is called as costodiaphragmatic recess. Likewise, we have got another recess that is present somewhat here. We can call it as costo-mediastinal. So we can see the costal part of the parietal pleura. It is present posteriorly as well. So we can see this particular segment. We will see here that the lung is present up to this particular extent, and we can see this particular region of the parietal pleura is the region where again both the surfaces of the parietal pleura, they come in contact with each other, and we can call this particular segment again as costo-mediastinal. Okay, this is the costo-mediastinal pleura, and this is the costo-diaphragmatic pleura. Okay, this is present medially, and this is present on the lower part of the lung, or you can say lower part of the thoracic region. Okay, I hope everyone is clear with this thing, the pleura.
Yes,
The
sir.
recess, sorry, the recess. Okay, the recess. Okay, uh, okay, and these recesses have, it is written that it is of clinical importance. Why? Because we can see in certain conditions, such as pleural effusion, we will see that there will be fluid that will get collected in certain regions of the lung. So we can see these are the potential regions where this fluid can get collected. Okay, and because of that, we can access these particular segment of the pleura, where we can just access it, and we can take out the extra fluid that is present here. Okay, and that's why it becomes important from clinical point of view. Okay, the recess, the costodiaphragmatic recess and the costomediastinal recess, two recesses we have got when we talk about the parietal pleura. Clear to everyone? Okay.
Yes, sir.
Okay. Uh, just pardon me for my voice. I'm not feeling well today. I hope you might be feeling some difference in my voice. Okay. Okay, we have talked about this particular slide. Now we have talked about the nerves, as well as their blood supply as well. Okay, and let's stop it here only. I'm also not feeling good today. Okay, we will just talk about this, and we will stop it, and we'll talk about the thoracic duct in tomorrow's class. Okay, so right now here we can see what we can see here. We are supposed to talk about we talked about pneumothorax earlier also, and we can see when there is blood, we can see that when there is some gas, or maybe you can say water or something, fluids which enters this thing, which enters the pleural space. In that case, of course, it will decrease the surface tension. I think it is again the same thing that is being repeated here, and it is in that case we will see the surface tension decreases, and in that case because of that we will see the visceral pleura will not be able to cope up with the parietal pleura, or we can say the inner layer, it is not able to expand as much as the outer layer is able to, and because of that, overall this thing will decrease. And the thing is that upon percussion, can anyone tell me the meaning of percussion? What is percussion? uh,
It
I
is
think it is
used to like
With
measure the
clapping
lung
hands.
sound. Some,
yeah, you can use percussion is basically a process. We can use it to hear certain sounds of the lungs, right? We can just tap on the thoracic region, and we can hear it, and we can, and that is called as percussion. So if we tap the thoracic region, and if we see that the sound is hyper resonant, it means if we are able to hear, you can say, the sound is echoing, है ना, या फिर हम कह सकते हैं कि sound जो है that is increased, है ना. In that case we can say that that there might be presence of air molecules okay, within this particular layer, and there might be prevalence of pneumothorax in that case. Okay, it means on percussion, the sound becomes hyper resonant. Okay, in case of pneumothorax. Okay, so we are done with the pneumothorax. We'll talk about thoracic duct tomorrow. Okay, I'm not in a state of today. I'm not in a really not in a state of completing it. Okay, I hope till now we are clear.
Yes, sir.
Yes, sir.
Okay.
Sir.
Also, just let me tell this thing. Tomorrow in the morning, I've to actually go somewhere. I'm actually stuck in something. Will it be possible for you to take the class in the evening only for tomorrow? Tomorrow,
Yes, sir.
okay,
Yes, sir.
tomorrow and on 25th. On these 2 days, I'm stuck in the morning. Um, I'll just let you know. I don't know whether it is possible for me. I will tomorrow in during daytime only. I will just text it in the group and just let me know if everyone is comfortable. We can just take the class in the evening. If everyone is not comfortable, then we can skip tomorrow's class and we might recover it maybe on Sunday or someday else. Okay. Just like okay. So then I will drop a text tomorrow in the group, and then we will see whether if everyone is comfortable in the evening, then we can take a class in the evening tomorrow and on 25th. Okay, I am actually stuck in some work tomorrow and 25th. Okay, let's then wind it up here only, and we will talk about this in the further classes. Okay, the thoracic duct. Okay, then thank you everyone.
Thank
Thank you,
you,
sir.
sir.
Thank you, sir.
Okay,
Thank you, sir.
okay.